Summer reading is in full swing. Visit summerreading.queenslibrary.org for our full summer reading program schedule, book list for all ages, and other resources to keep your kids engaged and learning all summer long. Plus, don't forget to participate in our reading challenge and social media sweepstakes for a chance to win some cool prizes. Queens Public Library, along with the New York City Department of Education, will be providing free lunches for all children under 18 throughout the summertime. Summer meals will be offered Monday to Friday from 1 to 2 p.m. through August 31st. Enrollment is not required and there is no cost. For more information and a list of participating libraries, visit queenslibrary.org. Back to school is around the corner. Visit queenslibrary.org to see all of our back-to-school programs and giveaways, and to read our guide with helpful tips on family communication, book lists, and more.
Welcome to Wellness Wednesdays. I'm Christopher Galarza, Queens Public Library's Community Health Educator. Today, we welcome Deepa Dewan, Health Education Coordinator from the Queens Cancer Center with New York City Health and Hospitals, along with Joshua Chung to discuss the health effects of smoking and vaping and to provide you with resources. As we go through today's presentation, please write any comments and questions in the chat so that we can respond either during or after the presentation. With that, please welcome Deepa Dewan, and Deepa, please take it away.
Thank you, Christopher. Good afternoon. I head the tobacco control program at the Queens Cancer Center at Queens Hospital. And today I will be talking about the health effects of smoking and vaping. So to start with, we've seen over the years, smoking rates, especially cigarette smoking rates, they have gone down significantly in the past 30 to 40 years. How we perceive smoking has also changed. There is, initially smoking was everywhere. You could smoke in the airports, planes, maybe about 30, 40 years back. If you see this graph over here, it was about 42%, about 30, 40 years, this cigarette smoking rates, and now it's about 14 to 15% at present. So cigarette smoking for males in the US adult population, it's about 16%. For females, it is about 12%. If you see the use of tobacco product, any tobacco product, it's still a little higher, about 24% for males, 14%, which is about the same as cigarette smoking for females. And this could be because of other products in the market, like now you have hookahs, you have electronic cigarettes, and I will be discussing some of them in the presentation today. So the e-cigarettes use, if we see for current, former and never smokers, it is pretty high again. So someone who's never smoked cigarettes, it's about 8% that they've tried an electronic cigarette. For current smokers, it's pretty much high. It's about 45%. And for former, it's 24%. In the youth as well, we've seen that the smoking rates for cigarettes, there's been a fall over the years. But for ENDS, which is electronic nicotine delivery devices, there's a steep rise from about 2013-14. The use has increased significantly in the last couple of years. In New York City, it's about 14% of the residents who smoke cigarettes. And for Queens, it's about 12%. So it's about similar, the rate for smoking cigarettes for adults in Queens as well as New York City. In New York City, there are about 13,000 high school students who currently smoke cigarettes, and there are 200,000 children who are exposed to secondhand smoke. In Queens, there are about 4,000 public high school students who currently smoke cigarettes. So what does it cost us? There are about 480,000 deaths in US every year, which is because of cigarette smoking. And if you see what accounts for these deaths, lung cancer, there are about 29% of these deaths are because of lung cancer. Heart disease is about 33% of these deaths are because of heart disease. COPD accounts for 21%. And then other diagnoses could be other chronic conditions or other type of cancers would be the rest, would be because of those risk factors or diseases in adults aged 35 years or older. So this graph over here, it shows the deaths which are caused due to smoking. And if we compare it with other risk factors or causes, we see that smoking would be the topmost bar, which the reasoning, the point for this is smoking is the number one risk factor for a lot of deaths which are caused, and all these deaths can be prevented if interventions are given at the right time. So why is smoking cigarettes so harmful? We know that cigarettes have nicotine, which is the addictive component in a cigarette, but there are 7,000 chemicals and 60 or more of them are cancer causing. So here you see a very short list of what's in a cigarette. It contains something like carbon monoxide, methane, acetic acid, which is used in vinegar, arsenic, methanol, which is used in rocket fuel, ammonia, toluene, stearic acid. And this is a short list again, but there are 7,000 chemicals and 60 or more of them are cancer causing. And this we've learned over the years. About 10 years back, we knew that there were about 4,000 or 5,000 chemicals. Now, recently, we know that there are 7,000 chemicals. So when you light up a cigarette, the chemical composition changes. And that's why it's not listed on a packet that there are 7,000 chemicals. So you're inhaling all these when you are smoking a cigarette. So now I would be talking about some of the diseases which are caused because of smoking, and cancer is one of them. So smoking causes cancer almost everywhere in the body. It can cause blood cancer, cervix, bladder, colon, esophagus, in the lungs, mouth, throat, pancreas, stomach. So basically, any type of cancer, you are at a risk if you smoke cigarettes. And here we see that the proportion of cancer deaths which are attributed to smoking cigarettes in adults 30 years or older. So the topmost would be from lung, bronchus, trachea, then larynx, esophagus, oral. So basically the respiratory system would be the topmost. And again, like I mentioned, smoking can result in cancer anywhere in the body. So how does it cause cancer, or how is it a risk factor for cancer? So when you smoke cigarettes, the poisons or the chemicals, they weaken the immune system of the body, and then which makes it harder to kill cancer cells in the body. The second reason could be they damage or change the cell's DNA, which controls the normal growth of a cell or the function. So when a DNA is damaged, the cells, they begin growing in out of control manner, and this can cause a tumor, which could be cancerous. And how can we help or prevent cancers. So even if you do smoke, if you quit smoking, the risk for cancers is reduced significantly over the years. Within 5 years of quitting, your chance of getting cancer of the mouth, throat, or esophagus is cut in half. In about 10 years, your risk of dying from various cancers or dying from lung cancer drops by half. And if you haven't smoked, 1 of every 3 cancer deaths would not happen. So if you are a non-smoker, yes, it helps significantly. But if you do smoke, quitting also reduces your chance of getting the disease or dying from the disease significantly. The second disease which can happen due to smoking, which we did see in the earlier graph, was heart disease, which accounted for 33% of the total deaths which were caused because of tobacco use. So how does smoking is a cause for heart disease, or how is it a risk factor? So if you smoke, it results in raising the triglycerides, which is a type of fat in your blood. It lowers the HDL levels, which is the good cholesterol. It makes the blood sticky and more likely to clot, which can block the blood flow to the heart and the brain, and that could result in a stroke. It damages the cells that line the blood vessels, increases the buildup of plaque, which is the fat. It could be calcium, cholesterol, or other substances in the blood vessels. And lastly, it can cause thickening or narrowing of the blood vessels. All these factors can result in a stroke or coronary heart disease, which is the leading cause of death in this country. So 1 in 3 deaths in women are from cardiovascular disease and stroke. And if you quit smoking again, the risk of getting the disease or dying from the disease is significantly reduced. And I would be talking about how quitting can help in the next lecture, which we'll be having in a couple of months. So how does smoking causes or is a risk factor for COPD? Smoking accounts for 8 out of 10 COPD-related deaths. So if someone smokes in their youth years or teenage years, it slows how the lungs grow and develop. So it's basically affecting the lung function. And this can increase your chance of developing COPD in adulthood. So it's the chronic obstructive pulmonary disease that blocks the airflow and breathing and affects the breathing related problems. So it includes bronchitis, emphysema, and in some cases, it can cause asthma. So what are the other health effects of cigarette use? It increases the risk of preterm delivery. If someone is pregnant, it can cause stillbirth, low birth weight babies, sudden infant death syndrome, ectopic pregnancy. It reduces the fertility. It increases the risk for miscarriages and birth defects. So it's important, if someone is smoking, they should think about quitting, or at least quit when they are pregnant. Other health effects of smoking cigarettes would be it affects the bone health. Women past childbearing years who smoke have weaker bones than women who never smoked. It affects oral health, like we saw previously. It can cause various kinds of cancers in the mouth as well. Also, it increases your risk for cataracts and cause age-related macular degeneration. It increases your risk for developing type 2 diabetes. It is about 30 to 40% higher for active smokers than non-smokers. It decreases the immune function, like we did see. If you are a smoker, it affects the DNA, and also it reduces the immune function of the body. Also, it can cause rheumatoid arthritis. So smoking can cause various types of cancers, starting from your mouth to liver, stomach, pancreas. Basically, every part of your body can be affected. If we see chronic conditions, it can lead to stroke. It affects your eyes. It affects your teeth, heart, lungs, pancreas, reproductive organs. It affects your bones. It affects your immune function. So the text in red is basically conditions or diseases we learned recently in 2015. So cigarettes have been in the market for 40, 50 years, and we're still learning about how they harm us or what diseases they can cause, and we're still learning about it. Also, secondhand smoke is equally harmful. In children, it can cause middle ear disease, respiratory symptoms. It can affect their lungs. It can cause sudden infant death syndrome. For adults, it affects the reproductive system in females. It can cause heart disease, lung cancer. It can cause stroke. So even if you're not a smoker, but you're exposed to the cigarette smoke, it can have similar effects as if you were smoking. So now we move on to electronic cigarettes and harmful. What are they? They're in the market. We see they have been recently been in the market, and they've become very popular. And there has been a lot of debate on whether it's safe to vape. It's safer than cigarettes. So what are e-cigarettes? They're electronic cigarettes, electronic nicotine delivery systems, as we call them, ENDS. They mimic the ritual of smoking a cigarette, and they may or may not deliver nicotine. And that's how they're marketed as well, that they do not contain nicotine, or we hear about the percentage of nicotine content in electronic cigarettes. So they contain a battery, a vaporizer, cartridge with a mouthpiece. So basically this section. This contains nicotine or may not contain nicotine. It does have chemicals like propylene glycol and flavorings. And that's why they are so popular, especially among youth, because they come in different flavors. So again, like I said, they're very popular among teens. And the reason behind it could be they're curious to try these devices. There is a lot of peer pressure because it's on social media. They're on social media. You see these TikToks, these advertising on social media accounts, and they put a lot of pressure for the kids to just try it. Some people could try it because of boredom. They see their friends, family using it, and it seems like it's acceptable, it's normal behavior. They come in a variety of flavors, and like a lot of kids say, it's like they're tasty or they're appealing flavors they want to try. And it is also seen as a status symbol. They're trendy. And lastly, a lot of people are trying them because they're advertised or they're said to be safer or harmless. And it helps them, and it could be helpful in quitting smoking. So when we said in a cigarette, there are about 7,000 chemicals that we know of, and 60 or more of them are cancer causing. In e-cigarettes, it contains nicotine or may not contain nicotine. It has ultrafine particles. It has flavorings, volatile organic compounds like benzene, which is found in the car exhaust, and metals like nickel, tin, and lead. So basically, it doesn't have 7,000 chemicals, but it has chemicals which are harmful. It has heavy metals. It has flavorings such as diacetyl, which is linked to a lung disease. It has nicotine, which is the addictive component again, and it has cancer-causing chemicals in it. So they could be safer if we are comparing cigarettes and e-cigarettes, but are they safe? No, they're not safe. And I will be talking about the health effects of using e-cigarettes or vaping. So why are they of concern? So these products are, we saw in the previous graph that in youth, there's a high, significant increase in the use of e-cigarettes. And it is of concern because they most likely have nicotine, which is the addictive component. So if you start using e-cigarettes, the likelihood of getting addicted to it or other product is a lot more. They have chemicals in the aerosol which are harmful. 60 chemical compounds are found in the e-liquids. Like I said, the risk of progressing to cigarette smoking is a lot higher if you start on with e-cigarettes. A lot of people also use both cigarettes and e-cigarettes, which is very common. Risk of getting addicted to other drugs is very high. If you get addicted to one product, your chances of getting addicted to other products also increases. And there is a link to other substances abuse and addiction. So most of the e-cigarettes, they're advertised as that they don't have nicotine, or they have low levels of nicotine, like it would be like 5% strength or 1% or 2%. So what does that mean actually? So one pack of cigarettes has about 20 milligrams of nicotine. So one pack has 20 cigarettes and you're taking 20 milligrams of nicotine from a pack, with someone maybe smoking a pack, half a pack. A Juul pod, it has 41.3 milligrams of nicotine, which is equivalent to 41 cigarettes. So it would be 2 packs of cigarettes if someone is vaping 1 pod of Juul. One puff bar has 50 milligrams of nicotine, which is more than 2 packs. And one Suroin pod is 90 milligrams, which is about 90 cigarettes. So when you see these percentages like 1%, 2%, we don't know how much nicotine you're taking, how long you're using that pod. So it could be very misleading that it's safer because you're actually smoking more than a pack by using e-cigarettes. So nicotine is harmful, especially for kids or teenagers. It is addictive. It damages the developing brain. It increases the risk of addiction to other drugs. And starting on these products earlier, it affects attention, memory, mood, impulse. It increases blood pressure. It affects respiration and heart rate. So basically, you're harming the cardiovascular system, you're harming the respiratory system, nervous system, reproductive system. And the risk of developing diabetes is higher. So if you start off with cigarettes, the risk for getting addicted to you start off with e-cigarettes, the risk of progressing to cigarettes is a lot higher. So adolescents who vape, they increase the odds of smoking about 4 times. Among 12 to 15-year-olds who are considered low risk of smoking, vaping was associated with 9 times increase in their odds of smoking. So just trying e-cigarettes, you expose yourself or you are at a higher risk of moving to other products. Also, the use of multiple nicotine products is very common. So 1 in 3 middle and high school students who use nicotine products use 2 or more. Many people who use e-cigarettes to quit smoking become dual users. And use of multiple nicotine products increases the risk of getting addicted to other substances as well. So young adults who vaped in the past year, they're 2 times higher odds of having tobacco use disorder. Teens who use e-cigarettes but never use marijuana, they're 2 to 4% higher odds of marijuana use. Nicotine exposure alters the brain and they increase the vulnerability to other products. So again, if you start off with e-cigarettes, you get more vulnerable, or the chances are that you get addicted to other products. So the health effects of e-cigarette use, like I mentioned, there are about 60 chemical compounds that are found in the e-liquids. Heavy metals such as cadmium, lead, nickel, tin, and copper were detected in the aerosols, which is produced by e-cigarettes. E-cigarettes produce fewer free radicals than combustible cigarettes, but even low levels of exposure to these free radicals can cause oxidative stress, which increases the risk of developing cardiovascular and respiratory diseases. Also, there are several substances which are identified which are either harmful or potentially harmful to e-cigarette users, including delivery solvents and propylene glycol, which can cause dry mouth, upper respiratory infections, and as well as pulegon, a known carcinogen. So if you are exposed to the e-liquid, accidental exposure or ingestion is dangerous. If you swallow it, it can even be fatal. More than 8,000 accidental liquid nicotine exposures are reported by US Poison Control Centers between 2012 and 2017 in children aged 6 or younger. And there are nearly 5,000 children under the age of 5 that were treated in the emergency rooms for e-liquid nicotine exposure in 2013 to 17. Also, there has been explosions. Defective or poorly manufactured or improperly modified e-cigarettes have exploded and have caused injury. In the last about 3 or 4 years back, we heard this term EVALI, outbreak by e-cigarette use. So this was a lung injury associated with e-cigarettes or vaping. There were 2,807 people who were hospitalized. 68 deaths were reported in patients with e-cigarette or vaping product use associated with this lung injury. So e-cigarettes were the cause of this lung injury that was caused, and it was we were made aware that the patients reported who had this issue or lung injury, tests showed that THC was put in the e-cigarettes or vaping product, and that was one of the reasons why this was associated with the lung injury outbreak. Also, e-cigarette use can cause bronchiolitis, obliterans. Diacetyl found in a majority of e-cigarettes were linked to this condition, which is also called popcorn lung. Popcorn lung, it's basically inhaled chemicals discard the tissue in the lungs, making it difficult to breathe. And the first case in teen who vaped was seen, the person who vaped for 5 months had this issue of popcorn lung. Also, there is association between vaping and COVID. Vaping poses a significant risk to young people when it comes to contracting, transmitting, and experiencing the health effects of COVID-19. So you're more likely to get COVID if you do vape. This is because vaping weakens the cardiovascular system, respiratory system, the immune system, and you're more vulnerable to the virus if you get exposed to the virus. So if you are vaping or using cigarettes, your risk for contracting the disease is a lot higher. So how effective are e-cigarettes to help smokers quit? And again, e-cigarettes came to the market because it was said that they help in quitting. So there's no compelling evidence that they help smokers quit smoking. There is one randomized controlled trial in New Zealand which showed that it does help, potential modest effect, which is 7.3% versus 5.8% with the patches and 4.1% with placebo e-cigarettes. So basically, we don't know if they really help or not, but there are other FDA-approved medications that we know of that can really help someone quit smoking. And these are some apps that can be helpful if someone is trying to quit smoking or trying to quit vaping. There is an app for teen, Smoke Free Teen. You could download it. It has a whole group where you can get in touch with other people who are also trying or who are in the process. And again, these can be really helpful if you are trying to quit smoking or vaping. So that is from me, and we can take questions at the end after Joshua from Mount Sinai. He will be talking about the resources about his program and some of the resources that he would like to share about some screening programs.
Hello, thank you, Deepa, for introducing me. Yes, hi. So, hi, my name is Joshua, and I'm from Mount Sinai's team of community engagement and outreach. So we're under Mount Sinai's Icahn School of Medicine from the Tisch Cancer Institute. I know it's a mouthful, but essentially what we would like to do is that we want to be there for the community. So we have culturally and linguistically targeted health education programs. So what that means is that we would like to give education presentation similar to what Deepa has just given, right, to local communities, whether it be in person, at site, at these communities, organizations, or something like this virtually on Zoom. So we just want to promote knowledge and just educations for cancer. So the different types of cancer that we could actually screen for example, breast cancer, for example, colorectal cancer, for example, cervical cancer, and also, of course, lung cancer. So we are here to just to promote what we want to do, because recently we have just formed new, I would say, sub branches of our program, specifically because we want to provide more linguistically targeted programs for non-native English speakers. So, for example, myself, I will be responsible for the Chinese program, right? And we also have team members that would speak Russian, that would speak Spanish, that would speak French. So we have different types of programs for these population, these underserved minorities, where sometimes information might not be very accessible in their native language, or resources might not be very accessible in their language, right? Because sometimes you call into these medical centers, they don't have someone that speaks their language, right? So that's what we're here to do. We are here to provide that link, that resource for people who speaks a different language to get that cancer education, preventative education information, as well as some navigation to their screening, right? So, for example, if in my example, for example, if a Chinese woman who speaks Chinese only would like to get a breast cancer screening, a mammography, then they can call in to us, and then we will help them navigate to get the screening, right? So we have a navigation system where we have people speaking in their language to help them to navigate, right? So we have right now a process set up for breast cancer. We have a process set up for colorectal cancer. We also have upcoming process setting up, also working in tandem with Deepa's team for lung cancer, a low-dose CT screening. So just want to share a flyer specifically for my program. But of course, if you're interested in the other different languages, you can feel free to contact me, and then I can put you in touch with all the different programs that and languages that we offer. So just bear with me for 1 second. Yes, so this would be a flyer for my program in Chinese. So essentially recapping what I said, it's a culturally and linguistically targeted health education program for the Chinese community. So right now, as mentioned, we have breast cancer, hepatitis B, and liver cancer screening and prevention, as well as colorectal, right? We're working on lung as well as prostate in the future. So there's my contact email address. I would say the best way is to reach me through email. Sometimes phone lines can get congested and I might not be able to pick up your call right away, but emails would be the best way. And yeah, just we want to, because it's a recent program, it's a new program that we're starting out. So that's why I'm here to promote it. Just to spread that awareness that we are here, just for the 5 boroughs of New York City, wherever you are, wherever, if you have an organization that you would like us to come and give a presentation, like what Deepa has done just now, you can feel free to contact us. We're not limited to any location. And yeah, and we look forward to be working with all of you who are interested, and just being out there to have as an extra resource for the communities that could be underserved. And yeah, so thank you for having me, Deepa, as well as Christopher. And yeah, and I'll pass the time back to you guys.
Thank you so much, Joshua, and thank you so much, Deepa. I do want to ask the audience, if you have any questions or comments, please put them in the chat so that we can address them. One thing that I was wondering about, Deepa, when you're explaining the different types of interventions for smoking cessation, you mentioned e-cigarettes, nicotine patches, and the placebo with some percentages. Can you just explain a little bit what those percentages were? I believe e-cigarettes was like 7.4%, nicotine was like 4 point something.
Let me go back. Do you want me to pull up the slide?
I don't think you need to pull out the slide. I think just explain and say what those percentages were again, just so that we can clarify.
So it was, you're talking about how the study where it shows that e-cigarettes are not that helpful in quitting. So basically, that was there has been various studies to see if e-cigarettes can be used as to stop smoking. And the point was, let me just see the percentage, like e-cigarettes, if we give a placebo, as in if we give the nicotine patches, they help to quit smoking, versus the placebo would be you're giving something to a patient saying that it can help you. So it showed that the patches were more significantly helpful in quitting versus other products like e-cigarettes.
Okay, great. I just wanted to clarify that for our audience.
Sure.
And then can you speak a little bit more about, you were talking about how the smoking rate has fallen, but now we're seeing a little increase in regards to electronic cigarette use. Are there any, theories or any reasons why we're thinking that's happening?
So, so this shift has been very recent. Cigarettes, we know, are harmful. Everybody knows that. Smokers know that as well. And 70 to 80% of smokers, and this is not a number that I just made up, there's research which shows that they want to quit smoking. But there are other products in the market which has come up now. Because I would say tobacco industry is a strong industry, so they're getting other products, they're advertising to the right people, which unfortunately is the youth. And the rates we've seen, especially in the youth population, not so much in the adults, for e-cigarette use have gone up. And this is because of the advertising on social media, Instagram, they have TikToks. If you go to the vape shops, you see in Queens, at least, I was doing a workshop very recently in one of the schools, and these small corner stores, they sell vape products. They're everywhere, and they come in a variety of flavors like bubble gum, you name it, and there's a flavor. So they have gained a lot of popularity very recently, and it is more in teenagers than in adults, even though we've seen a drop in cigarette use over the years, and that is possible for a variety of reasons. Especially in New York State, we have a lot of programs for the last 15 to 20 years that are creating awareness or education. There, you cannot smoke in public places, you cannot smoke on beaches. There's a shift in how smoking cigarettes is perceived. But then there are other products like hookahs, e-cigarettes, which are in the market now. So I would say we still are learning about these products because they're advertised as being safer than combustible cigarettes. And there still needs to be a lot of work in this area, especially creating awareness for education.
So I just want to maybe take some key points and let me know if there's other things you want to emphasize. So basically what I'm hearing is that, these e-cigarettes are basically a recent phenomenon that we really don't have the breadth of research that we have on them that we do with traditional smoking. And so there's a lot of maybe misinformation or just not fully understanding what's going on surrounding their health effects. And that could be contributing to why there's an uptake in using them.
That's right.
Okay, great. And then can you also speak a little bit more about the prescription medications that can help you quit smoking?
Okay. So I would be covering those in details in the next lecture, but I can definitely talk about them. So there are prescription, not necessarily prescription medications, but there are two prescription medications varenicline and bupropion, which have shown to help smokers quit smoking. And then there is the nicotine replacement therapy, which includes the nicotine gum, patch, lozenges, the inhaler, and the nasal spray. So there are 5 medications that come under nicotine replacement therapy. The nicotine replacement therapy, most of them are available over the counter, or there are programs that offer it at no cost, like New York State Smokers Quit Line is one of them. We here in our program, we offer it for free as well. City hospitals, if there are programs in city hospitals, a lot of them, I won't say all of them, but most of them do offer it for free if you come into the program. How they work is basically from the nicotine replacement therapy, you're getting the nicotine in your system, depending on how much you smoke. So it's giving you clean nicotine. And this will help in preventing the urge to smoke. As we saw, nicotine is the addictive component in the cigarette, but it's mixed up with 7,000 chemicals, which causes the risk for various conditions that we spoke about today. But with the nicotine replacement therapy, you're getting the clean nicotine. And a lot of people come up with this argument that why go on another form of nicotine from another thing? But if you weigh in the benefits, the risk, obviously these medications, we know that they work and they help you through the process to quit smoking. And obviously you'll get off these medications as well, because no one wants you to be on the medications permanently. So I would say nicotine replacement therapy, which covers the 5 medications and bupropion and varenicline, these have shown, there has been research which shows that they help someone quit smoking. And there is a lot of research on these medications.
Great. And if anyone is interested in them, please speak to your provider to see if they're right for you. And I want to highlight one of the things that you said, Deepa, was that a lot of people are like, well, why should I go on nicotine if I'm trying to quit nicotine? And one of the things that we really like to focus on in public health and community health is harm reduction, right? So like you said, you could either have nicotine with all those harsh chemicals from smoking a combustible to just having the pure nicotine. And so you're taking those other chemicals out, and it'll help you kind of get what you're really addicted to without all those extra harmful chemicals, which is really important in your journey to smoking cessation, which I'm sure you'll speak about more in the future. Another question that we had was, is there risk for secondhand smoke with e-cigarette vapor? Some of the things that people say is that, well, it's not smoke, so it's just vapor, so it's fine. Do we know anything about what's in that vapor and if it can affect others?
Secondhand smoke, yes, it is. Like I said, we're still learning about e-cigarettes. If there's any research on secondhand smoke from vaping, I don't know if there's a lot of data. Right. But yes, it is harmful. Like from cigarette use or getting affected by secondhand smoke from cigarettes, we are still learning about that still. But it's been 30, 40 years. So I don't know what it can cause, but maybe right now, but I can look it up. I don't think there's a lot of data on that right now. But like the figures I showed, like of how it affects, cigarette smoking can affect, like various parts of our body. And there was that text in red on it, right? So those diseases or conditions we just recently learned a couple of years back, and we're still learning about how cigarettes are harmful. So yes, e-cigarettes are harmful. Uh, the smoke from e-cigarettes is potentially harmful.
Hmm.
What it can cause, I'm not sure right now.
So better to be safe and treat them the same way as we would treat traditional cigarettes.
Is
Uh,
my take on it, yes.
and then, I think this may ha- be in the similar vein, but so cannabis is legal now in New York State. Is there any research or information regarding the health effects of smoking cannabis? Do we know anything about that currently?
Um, well, that's not my area of
Okay.
expertise. I would just say that. Uh, but I mean, yes, it is
Yeah.
basically harmful. It affects, like, if you get addicted to it, there's a whole lot of things that can
Hmm.
happen. Uh, but again, it's not my area of expertise.
Sure, thank you. Is there? I'm not seeing any questions in the chat. Is there any, one last thing that you really want to drive home, Deepa, and one last thing, Joshua, that you just want to drive home regarding cigarettes and vaping?
So I think about the prescription medications, like I said, I will be talking more about that in detail in the next lecture or the next talk. But I think there is some a question, maybe I'm not sure, but there is nicotine replacement therapy. It's available over the counter. You can call up the New York State Quit line to get free medications. They offer the gum, the patch, and the lozenges. Uh, the nasal spray and the inhaler are again prescription medications, and it really depends if the insurance covers it or not. But the patch, gum, and the lozenges are usually they're available over the counter, or they're programs where you can get it free as well. All the medications, the nicotine replacement therapy, as well as Chantix and bupropion, are effective in helping someone quit smoking. Uh, Cigarettes or quit vaping as well. So if you are vaping or you're smoking cigarettes, all these medications can make the process easier for you, and there is a lot of research to back it up that they are effective. My take home would be I think this was from the Surgeon General report, uh, which I really like, where it said, like, no cigarette is safe.
Hmm.
So it's just not safe. It can be advertised in any way, but does it affect you? Yes, it will probably affect you or your health in some way.
Great. And Joshua, do you have one last thing?
I think no, Deepa. I think Deepa summed it up really well, and yeah.
Awesome. Yes. So thank you everyone for joining us. We'll see you next time in our next Wellness Wednesday, and we will welcome back Deepa for her second part of the series. So have a great rest of your day, and we'll see you next time. Bye,
Thank
everyone.
you. Bye bye.